Welcome to Healthcare Reform Demystified. Today's episode, Extended Family Ties, Adult-Child Coverage under the Affordable Care Act. When we talk about things that run in the family, we usually mean physical traits that crop up from generation to generation. Someone may have their father's eyes, their mother's nose, the cheekbones of their great aunt, which sounds a bit strange when you think about it. In any case, thanks to a provision in the Affordable Care Act, healthcare also runs in the family, or at least it runs a little longer than it used to for certain family members, namely dependent children. Those health plans that provide coverage for dependents are now required to cover adult children until they reach age 26, regardless of student status. In this day and age, it's not uncommon for children to remain dependent on and even live with their parents well into their 20s. Of course, the adult children would have outgrown toys like this, but it is useful to demonstrate the implications of healthcare reform regulations regarding dependent coverage. Here we have our family, mom, dad, and their adult son, Bob, who's older than 18 but younger than 26. You'd think they would know how old he is. Now let's say that Bob has a job that offers health care benefits. Under the new law, even dependents that have access to other health care coverage through an employer may also be eligible for coverage under a parent's policy. This is true whether or not Bob actually lives with mom and dad. Similarly, if Bob loses his job, he would not need to use or exhaust COBRA coverage before seeking coverage under his parents' plan. Now, let's say that Bob gets married to Jane. The health reform law does not require that the spouse of a dependent be covered. And if Bob and Jane start a family of their own, their children, the grandchildren of our original mom and dad, are not covered, although there may be some individual state rules that would make them eligible for coverage. Every family is different, and there are variations between plans. But by and large, the new requirements for dependent coverage are fairly straightforward. There are a few basics you'll want to review. Health plans offering coverage to dependents must extend coverage to adult children until they turn 26. Adult children will be eligible for coverage regardless of marital status, residence, student status, financial dependence, employment status, eligibility for an employer's health plan, eligibility for COBRA coverage. Grandfathered plans are not required to offer coverage to adult children if they are eligible to enroll in another employer-sponsored health plan. The healthcare reform law does not require that health plans extend coverage to the spouses of dependent children or to the dependents' children. Dependents whose coverage may have lapsed prior to health reform regulations will not be automatically reinstated. They must re-enroll in the plan during the employer's defined enrollment period. There's an old proverb that says, you can't choose your family. While the health reform regulation doesn't change that, it does give families more choices when it comes to health care. And when it comes to choices, more is better. You can find more answers to questions about the Affordable Care Act on the United for Reform website. And as always, contact your broker or a United Healthcare representative with any questions about your plan. Great Aunt Hortense's false teeth must have been giving her trouble. Made a whalebone in those days, you know.